Hello, thanks very much for joining us for this CPD event. My name's Alan Tennyson and I'm the co-chair of the Irish Society for Behaviour Analysis, along with Dr. Laura Skelly, who's the other part of the chair. So in this CPD event, we're going to hear from Dr. Deirdre Kearney. Now, Dr. Kearney's work that she'll present here was conducted under an Irish Research Council grant and under this supervision of Dr. Olive Healy of Trinity. And of course, we know the substantial contribution that Dr. Healy has made to behaviour analysis in Ireland and internationally. Now, what Dr. Kearney's work considers is the systemic factors that influence the implementation of positive behaviour support, specifically for adults with disabilities. Now, as we know, the contextual factors and the environmental alterations really are central to positive behaviour support. It's called behavioural since behavioural is the dependent measure. It's what is measured, but in effect, it's always the environment that is changed, and leading some to call it contextual science or contextual behavioural science. So while we measure the behaviour, we're always seeking to influence the context in which that responding occurs, and that really is what has changed. So behaviour support is not seeking to change the person, it's seeking to change the environment in which the person is subject to, and then seeing what the effects are on particular concerning behaviours, as it is in this case. So what Dr. Kearney is looking at is the implementation science and what we can learn from that about how to bring effective change within organisations. And she will look at the pre-existing research in that area, and then what more can be learned, and what her studies have shown, but what affects positive change within the organisations that support people with disabilities. Now, this is particularly pertinent, and it requires a flexible approach from organisations. And as we move into an area where we may be looking at individualised budgets, that gives us a kind of an imagined space where we can imagine new ways that services might respond to the needs of people with concerning behaviours. It also, as we know, the statutory instrument number 367 of the Health Act requires organisations to provide, where concerning behaviour is present, to provide a positive behaviour support. So how that is delivered and what the implications of that are need to be an ongoing consideration. In our previous talk, we heard from Professor Peter McGill, Dr. Jacob, and Professor Mark McLaughlin, and they outlined, what positive behaviour support, where it needs to go at a broad level. And now in this, we're going to get into the more practicalities about maybe how it's to be done. So that kind of wraps up what I'd like to say. So I'll close now and we'll hear from Dr. Kearney. Okay, thank you very much.
Welcome, everyone. So this presentation is focused on an implementation roadmap for setting-wide positive behaviour support in adult disability settings. So my name is Dr. Deirdre Kearney, and this research programme was supervised by Dr. Olive Healy in Trinity College Dublin. So just to introduce the research, really our focus and the reason that we selected this research topic is because adults with intellectual and developmental disabilities, as we know, are one of the most marginalised groups in modern society. And we're very aware, certainly in the current climate, of the budgetary pressures and the recruitment difficulties that are considerable in disability services today. And when you combine that with stringent regulatory requirements, the need for innovation and sustainable equitable and quality services for the most vulnerable in our population is unmistakable. So this is a conceptual paper that presents an implementation roadmap, as I said. So it discusses the significance of a whole organization roadmap in the context of limited budgets, quality assurance, and resource issues in the field of disability service provision for adults. And we examine the use of this roadmap in terms of socially, politically, and economically important areas of investigation. So it's important to note, to acknowledge that this research programme was funded by the Irish Research Council's Employment-Based Postgraduate Award, and the participants of the research were St. Patrick's Service in Kilkenny, which has now been kind of rebranded and it's known as Aurora Adult Services. And it was done in collaboration with Trinity College Dublin. Okay, so we'll go straight into it. So firstly, before I get into the roadmap, I just wanted to reintroduce positive behaviour support. I know everyone's probably very familiar with the various definitions, but it's good, I suppose, to just reorient ourselves with that. So positive behaviour support is an applied science that uses skills teaching and systems change methods to enhance quality of life and hopefully, as almost a collateral impact of that, minimise distressed or problem behaviour. So that's that traditional definition from Carr and colleagues from 2002. But what we're specifically looking at here in this piece of research is the setting-wide model, which is a multi-tiered model that employs a range of evidence-based interventions to support all behavioural expectations or all support needs for a population in a specific organisation or a specific setting. So there is a graphic of the model, which we'll go into in a moment, but just to have a brief look at how positive behaviour support is traditionally implemented. It can be implemented in several ways. So what we see sometimes is that positive behaviour support might be implemented by specialist behaviour support teams. So we see some research on this by Too Good and colleagues in '94, and there's quite a bit of research examining the implementation by specialist teams. And we see that here in Ireland as well, with behaviour support teams in various services. We also see it sometimes implemented by individual practitioners. So you might have a behaviour support specialist or a behavioural psychologist working as part of a clinical team in the service. But sometimes there are multi-tiered setting-wide approaches used, so the systemic model that we're going to introduce now. However, the research on this is quite limited. What we have seen traditionally and what led us to this piece to examine the setting-wide approach is that the specialist-led model of delivery, which seems to be the most common at the moment, can result in long waiting lists for intervention due to the limitations in the availability of professional clinical resources. So there's lots of research to support that, and Irish research in particular by Gunning and colleagues in 2019 and O'Brien and colleagues in 2019 as well. So we're seeing trends now in the positive behaviour support research emerging, examining these setting-wide or systemic models. So the research in this traditionally or initially was focused on school settings. So this is a model called school-wide positive behaviour support, or sometimes it's the acronym used is SWPBS, which is school-wide positive behaviour support and interventions. But the framework is similar. So what we see are these different tiers or different levels of intervention. So tier one, which is the first or the foundation tier that we see at the bottom of that graphic there, involves the adaptation of physical, interpersonal and organizational contexts to enhance quality of life and reduce distressed behaviours. We see McGill's research there on capable environments really fitting into that tier one model or that tier one part of the framework. And alongside these physical and interpersonal adaptations, we also see an important focus on the capacities of an organisation. So a big part of those tier one interventions are building the capacities of, for example, staff teams in the service and developing infrastructures to support the introduction of these interpersonal and physical enhancements to enhance quality of life. So the Tier 2 support provides additional focus supports to allow for early identification of those individuals that are vulnerable to experiencing distress behaviours in the context of a greater level of support need and other complex contextual factors. So at Tier 2, it's designed to support those individuals that have those support at Tier 1 but need additional input. So more focused multidisciplinary supports can be provided, and maybe more positive behaviour support expertise can be provided at that level. But it's still at the level of group-based or team-based supports. So then with Tier 3, we see specialist individualized supports. And this is our more traditional, usually our more traditional concept of what positive behaviour supports are. But with the system-wide model, they are designed to be introduced after these other two tiers are available, if you know what I mean. So with Tier 3 specialist individualized support, they're considered for individuals that either don't respond to Tier 1 and Tier 2 supports, or they may be individuals that present with significantly distressed behaviour, so very, very high risk to themselves and or to other people. So supports at Tier 3 usually involve intensive specialist individualized supports provided by maybe a behavioral psychologist or somebody with behavioral expertise. But with the systemic model, the important part of that is that when those Tier 3 intensive individualized interventions are introduced, there's already an infrastructure in place to support the introduction of those interventions. So that's an overview of the model. So in terms of this research series, I just want to provide a bit of context as to how this roadmap developed. So firstly, what we looked at was a review of the literature in the implementation of setting-wide models of positive behaviour support with adult populations. So the first stage of the research did a systematic literature review of these implementation studies. And we used the findings of that systematic review of what worked in adult settings to conduct a randomised controlled trial of introducing a setting-wide model of positive behaviour support in an adult disability setting. Now, the randomised controlled trial focused primarily on that Tier 1 level of intervention, because within the service there already really was a Tier 3 intervention available, but we focused on introducing that foundation level. So following the completion of the randomised control trial, we then conducted process evaluation, it's called, which is where we try to really examine the results of the randomised control trial to see what was effective and what wasn't in terms of the findings of that RCT. So we could really learn from that, from the implementation of the Tier 1 PBS framework. We then went on to complete a qualitative examination of the experiences of the staff involved with implementing the setting-wide positive behaviour support. And we used a model of implementation science to do that called the COMBI model. You may be familiar with that from our COVID days, but that examines the capability, opportunity, and motivation to change behaviour. So that was a series of studies that were conducted. So it was all of those different pieces of research that then informed this roadmap. So the roadmap is the culmination of all of that to try and apply the findings to develop a strategy for organizations seeking to implement the systemic model of support. So just to introduce this roadmap chapter, when we got to this stage of the research, really what was highlighted in neon, I suppose I would say, is that the model itself of setting-wide positive behaviour support is relatively sound, and there is a lot of good quality research indicating that it's an effective, robust model of providing positive behaviour support. But the findings of the RCT, the qualitative study, and the process evaluation were that implementing this evidence-based model was problematic. So what we wanted to do really with this chapter, with this piece of research, was to apply a model to apply implementation science to understanding how to implement positive behavior support effectively. So shelves full of intervention manuals, they don't necessarily translate to innovative practice or change in human service systems. We've learned this working in in healthcare. So a large proportion of long-term changes in healthcare communities fail, and there's research to evidence that. And as I said, it's often related to implementation barriers rather than ineffective programs themselves. So what we looked at now was empirical developments that are focused on bridging theory to practice gaps. And these empirical developments have fostered appreciation of the position of implementation science as a conceptual and methodological tool to do this. So within implementation science, there are more than 150 theories, frameworks, and models. It's vast, it's broad. So it's challenging to find the correct model or an appropriate framework, when you have all of that to choose from. So we had a challenge there of how do we approach this? Which model of implementation science do we use to try and fit how do we implement positive behavior support? So what we did was we went right back to the definition. So just to come back to that, implementation science is defined as the scientific study of methods to promote the systematic update or uptake of research findings and other evidence-based practices into routine practice and to improve the quality and effectiveness of health services. So as a concept, it makes complete sense to adopt this model to improve implementation of positive behavior support. The motivation for this is that positive behavior support is mandated under the Health Act, so there's a legal obligation to implement it effectively. So how do we do that? So what we did was we found a systematic review of the implementation literature by Fixon and colleagues. And in their synthesis, they identified specific stages in effective implementation science and effective implementation processes. These 6 stages are illustrated now in the current slide. So what we did was we took the findings from our research series and mapped them onto a conceptual framework of implementation science to provide a roadmap for future research and practice. So this synthesis of the research took these 150 theories, frameworks, and processes, and I suppose crystallized them into this pathway, into this conceptual pathway that starts with exploration and adoption, moves on to program installation, into initial implementation, full operation, innovation, and sustainability. So the work in this chapter was to take all the findings from the research series and see how we can provide guidance to organizations to follow these important stages of implementation so we can effectively introduce, adopt, and sustain evidence-based practices focused on promoting quality of life and reducing distress behaviors for all of the people that we support in adult disability settings. So in this particular presentation, we're going to primarily focus on the first 3 stages because they'll be the most relevant for most organizations. But information is available on the latter 3 stages from the authors, from myself or from Dr. Healy in Trinity College. Okay, so let's start with the first stage. So exploration and adoption. Just a quick note, actually, even in that implementation process, we can see already where sometimes we might slip or trip, in that we often start at the initial implementation stage. So that's what was an important finding from this research program, that actually we're missing the first step already. So we're starting on the back foot. Where we should start is with exploration and adoption. So with exploration and adoption, the first thing we want to do when we're looking to embed a systemic model of positive behavior support is to evaluate the fit between the organization's needs, the relevant evidence-based practices, i.e. positive behavior support, and the contextual resources available for decision-making within the organization. So again, as I said earlier, like a relevant contextual element is that positive behaviour support is mandated under the Health Act as an evidence-based practice for vulnerable adults living in residential settings. So there is a responsibility for service providers to direct appropriate resources for the provision of this person-centred approach. So what we found in the RCT was that organisational buy-in was challenged by the cessation of an implementation working group. And that happened quite early on in the randomised controlled trial due to circumstances completely outside of our control, and that piece of intervention actually took place during the COVID pandemic. So the implementation team were dismantled to focus on responding to the crisis with the pandemic. But what it helped us do was evidence that that implementation team was crucial for effective exploration and adoption of the model. So commitment from leadership within an organization is a key ingredient for organizational change, and this is reflected in this first stage. So what we identify in this roadmap are a couple of tools to explore and establish that commitment from the organization. So one of the tools is called the Organizational Readiness for Implementation Change tool, and that's provided with this chapter, which hopefully will be published soon. Actually, it's just being reviewed at the moment. So what we're trying to measure with this particular tool is a parameter called organizational readiness for change. So what can often happen, and what was seen in the literature review actually, was that in research examining setting-wide positive behaviour support in adult settings, organizational buy-in was not always established, and that was a problem. So this is how you can, I suppose, check the climate within an organization for change, and how you can identify if there are barriers for organizational change, what they are and how to address them. So it's an excellent tool for that. As I said, one of the next steps then is to establish an implementation task force. And what we found was that it's crucial that key stakeholders are on that task force. And that would include adults with ID themselves, their advocates, the head of the organization, whether that's the director or the CEO, but members of that senior management team are key, because other research findings were that oftentimes those implementation teams were led by somebody by say a positive behaviour support specialist or a behavioural psychologist, and that actually can hamper organizational buy-in. So it's very important that these types of stakeholders are present. And then it's also very important that direct support personnel are on that team, as they have their own unique perspective and key experiential knowledge and experience to provide on that team. Multidisciplinary clinical team members should be on that team, and also it's key that there's administrative support on that team to provide an anchor in terms of because there's a huge amount of documentation required. Okay, so those are key team members to have on the implementation task force. So that's the first step of exploration and adoption, and there's also a table of tools available for that stage. So then, once that is established, then the next step is to move on to program installation. And the order of these steps is significant. It should occur in this order, or it's quite likely that there will be implementation problems. So with step 2, what we want to do is look at funding applications to commissioners. That can be one of the stages, so that there are adequate budgets to sustain and support the implementation of setting-wide PBS. And what this roadmap shows is that part of the evidence available to make these funding applications are the evidence for the clinical and cost effectiveness of these setting-wide models of positive behaviour support. Part of this part of the stage in the process, is also linking in with HR departments within the organization, because the installation of the program will involve reviews of policies within the organization itself. So you would be looking at, for example, the recruitment strategies for an organization and ensuring that a positive behavior support culture is reflected in the policies for recruitment, staff support, and the implementation of services and individual support within that organization. So there will be policy development and revisions. Another part of that commissioning piece will be commissioning workforce development programs, and that these should be standardized across services. And actually what we talk about in this chapter is proposing the commissioning of standardized setting-wide PBS workforce development programs in partnership with academic institutions and government departments, so that these can be provided across the different CHOs or nationally, and we have this equivalence of skills across the nation, and that would be a way of doing that. And then finally, with program installation, embedding a quality assurance system using something like the COMBI model, which is where you're collecting information about the capability, motivation, and opportunity for behavior change within workforce teams, is a key part of supporting the infrastructure for the next stage, which is where you're actually implementing the model of behavior support. So that's stage 2 of the roadmap. And moving on to stage 3, this involves the initial implementation. So perhaps evolution is a more efficient description of the initial implementation of a program. It's very important to highlight at this stage that change does not occur uniformly in all parts of an intervention or in all parts of an organization. So the research finding from the research program we talked about found that common issues or common barriers that were faced were resistance to change, inertia, adherence to the familiar, this is how we do things around here, mingled with difficulty with implementing something different and unfamiliar. So with this initial implementation stage, a very important piece of education is creating awareness in organizations that initial implementations are problematic, that you won't see huge improvements immediately. Because this can protect from disappointment or drift following the problematic initial trials, because that's what we encountered with the RCT, with the research program, and other research findings showed similar outcomes. So creating a culture of this is exploration, this is change, it's problematic, it's difficult, but we need to learn from the outcomes and collect data on the outcomes and make small adjustments to improve implementation is really key at this initial implementation stage. So the inclusion of feedback systems from the onset, where consumers and implementers are committed to examining these barriers and enablers, essential ingredient for sustainable interventions. So on that, it's essential that quality data collection tools for implementation, fidelity, and outcome measures of impact are used so that this implementation can be refined. So as part of this stage, we developed a table of these good quality tools, I would say. So you can see part of the table on this slide. So we have the dependent variables to measure on the left. So the type of, this isn't a comprehensive view of the table. The full table is available. Just drop me a line, I'll be happy to share it with you. So some of the dependent variables that you would be collecting data on are the behaviors of concern itself. I mean, there will be routine incident reporting and that embedded in the organization, but it's important to highlight the different ways that you collect that data and have a uniform way of doing that, and not only of collecting it, but also using the data, reviewing and analyzing it. Other dependent variables are adaptive behaviors, quality of life, quality of support, and it goes on to other things like organizational readiness for change. But this table is really useful because it brings all of these tools together in an easily accessible format. Also, the COMBI framework that I mentioned earlier is a really useful qualitative feedback tool to explore behaviour change within the staff team. Other tools that are identified here, like satisfaction of employees, a useful tool called the active support measure, which is both an observational tool and an informant-based tool, which is very good in capturing information about the quality of support for the individual. So we really want to be embedding these data, these feedback loops, these feedback systems, so that we can fine-tune the initial implementation of the setting-wide model of positive behaviour support. So an innovation that we developed at this stage was a Tier 1 benchmark of quality assessment for adult disability settings. So there is a tier, this is based on the benchmarks of quality assessment that's available for school-wide settings, but what we did here is we adapted it for adult settings. So essentially this is a quality assurance tool for adult disability settings to be able to assess the quality of the implementation of their setting-wide PBS framework. Which is a really important innovation, actually, because this type of tool was not available for adult services before this point. It's a self-assessment measure, so it's used for organizations to do their own assessments of the quality of their own implementation. However, the tool could potentially be adapted to be used by, for example, ICWA services to be able to monitor the quality of setting-wide positive behaviour support nationally. So I'll just give a quick example of some of the items in this tool. So this is just one of them. So there are 9 different critical elements identified within the tool, but this particular one is the implementation team itself that I mentioned at the exploration and adoption stage. So this is your organizational stakeholder implementation team. So in the quality assurance tool, what this checks is that there is a positive behaviour support team that has organizational senior management team support. So the data source for this are things like meeting agendas, meeting minutes and materials, and there's an inbuilt scoring criteria. So this tool could be used on a yearly basis. It outlines every different stage of Tier 1 of positive behaviour support that's critical for its implementation, how to collect, what data you need to collect to evidence this part of the Tier 1 framework, and how to rate it or score it. So you can assess the quality and improve the quality on an ongoing basis. Okay, so that brings us through the first 3 stages of the roadmap. So you can see it's quite complex. It's not a straightforward undertaking to implement positive behaviour support at a systems level. However, it is a very worthwhile undertaking because if we can embed the infrastructure for this, it provides evidence-based practices and human rights focused support for the entire population of an organization in an evidence-based way, because we're using these tools of implementation science to implement these frameworks. So that brings us up, as I said, to the initial implementation stage. When that is implemented successfully, which takes quite a period of time, you're talking 3 to 5 years before you would then move on to say that you were at full operation stage. So that's where setting-wide positive behaviour support has become the routine practice of an organization. Then you can move on to innovation. So that's improving and enhancing the model and creating new systems for implementing setting-wide positive behaviour support. Especially at that point, you'd be saying, is this model the most effective model, or are there other ways that maybe might improve the lived experience of the people supported? And then after innovation, you look at sustainability. How can you embed this support structure over time? How can you secure the funding and commission the funding so that these outcomes are sustained for people supported throughout their lives? Because we know this, the lifespan perspective, is one of the core features of positive behaviour support. Okay, I thank you for listening to the presentation. I hope that gives something of an insight into this roadmap of positive behaviour support. As I said, this particular piece of research is currently under review. Hopefully it will be published shortly. But if you would like further information about the research findings, you can contact me at Deirdre@behaviourclinic.ie or through the Irish Society of Behaviour Analysis. So thank you for your time.
Right, that was wonderful, Deirdre. Thanks very much for sharing your work with us. Like, a few things stuck out to me in particular. I mean, you made reference to how this tool could be used maybe by HICWA or others, or as a self-assessment tool to assess the implementation or where they are in the implementation of. So what would you say about that? Or like, could you tell us a little bit more about that? Or
Absolutely, Alan. Yeah, so the benchmarks of quality tool, I only took a tiny piece of it on that particular slide, but it's quite an extensive tool. So it's adapted from the Kincaid, I think it's 2021, benchmarks of quality for school-wide positive behaviour support in implementation. So that's more relevant for school settings. So there was quite a bit of adapting required, because like some of the pieces of school-wide positive behaviour support are like teaching, say behavioural skills to the whole class, or we had to adapt that for adult settings to reflect obviously adult human rights and adult agency and the support need for an adult population. But we did that. Now I totally take on board, this is not what would you say, a statistically validated tool, but it's a very pragmatic one. So we adapted the various elements. So there are 9 critical elements identified within that tool. I'll just take you through them. The first section focuses in on the setting-wide positive behaviour support implementation task for the team that are driving the implementation. So it identifies all of the different elements that you need for that team to function effectively based on the implementation science, what data you need to gather to evidence the effective operation of that task force, and how you can rate how your task force is functioning. So there's a rating scale for each piece of that task force. So that's the first critical element. The second one is organizational commitment. So it checks in, is this organization committed? If not, I mean, there's little point in driving forward, for example, the workforce development program, if those frontline staff are not going to be supported by the organization to implement these strategies. So it all fits in. So there's organizational commitment at the second critical element, what to measure, how to evidence it, and how to rate. Do we have this? Do we not? And that then leads to an action plan. The third critical element are ethical procedures for responding safely and ethically to episodes of distress. So it identifies all those different components to evidence that this organization has safe ethical procedures for responding safely. The fourth critical element is data entry and analysis, and that there's a data entry and analysis data plan established and it's organization-wide. So we have a system for collecting effective data across the organization. And there's all different pieces within that tool, how you do that, how you collect information on it, and how you can rate, do we have this, do we not? And if we don't, how do we establish an action plan around it? The fifth critical element are teaching adaptive behaviours and systems of skill development across the organization. How you would gather information on that, for example, using something like the adaptive behaviour scale, or equally it looks at how do we collect information about the set of our frontline staff teams, and how do we develop their skills so that we build the capacity. So all that's embedded in there.
Okay.
So that's the fifth. The sixth is recognize, so how do we promote and sustain adaptive behaviours for people supported and for staff? Seventh critical element is that there is a specific training policy and plan for teaching, for skill development in staff and for promoting adaptive skills in people supported. The eighth critical element is the implementation plan for setting wide PBS within the organisation, that they have their own implementation. It's almost like a, what would you call it? What am I trying to think of? Strategic plan, but it's in the culture of PBS. And then 9 is a full evaluation of the whole thing. So that's all embedded in this benchmark for quality too. So this can be used, as I said, as a self-assessment tool for the organization, but it absolutely could be slightly adapted to be used for someone like HICWA to assess the quality of the provision of positive behaviour support nationally.
Right. And given that that's a statutory requirement, as you mentioned, I think it's statutory instrument number 367 of the Health Act that names that as a statutory requirement for services, that's obviously has practical implications for services or statutory authorities like HICWA to aid their inspection. But I was delighted to see as well that you added administration in the core people that are required, because I think it's overlooked. And then, of course, the vital role of administering both measures of behaviour change or measures of adaptive behaviour, and that can be resource intensive, can't it? And that requires time and funding, obviously, to meet that time. So I thought that was a very important addition that I hadn't seen in other places, so it's great to see it there. And it's frequently overlooked. So, like, what would be your, if I could be, like, what would be your kind of dream for where this would go, or like, how would you see this developing? Like, what would you like to see done with this in the future?
So look, we've seen really inspirational, I think, developments over in the UK with their the name won't come to me now, but they have like nationally funded programs of, say, practice leadership programs to train practice leaders, to train frontline teams. So what I'd love to see actually are this kind of collaboration of adult education settings and health services to start to provide quality training to both managers and frontline staff in disability services. Because part of the initial buy-in piece, so I didn't get to talk too much about that around organizational readiness, is a big part of organizational readiness for change is knowledge and education. So if the leaders of our organization, of adult disability organizations, have the opportunity to learn about these systemic frameworks, how successful they can be, what the evidence base is to support them, if that could be provided either by HSE land or through leadership training or something like that on a national level, I think that would be a great next step, because we're hitting that first stage of implementation, the exploration and adoption level. After that, I think, and as part of a natural progression on from that we could provide those workforce development programs that are funded by the HSE in collaboration with our national education institutions like Cork University and Dublin University, Galway University, that we could have a sort of national rollout of workforce development programs, positive behaviour support. As you said there yourself, Alan, like it's mandated, linking in with the absolute crisis in social care service provision at the moment, and trying to use efficient ways of improving the lived experience of the people that we support. There is a big problem in the equivalency and skill set in the frontline teams across services. And this would be a way to potentially address that, because those foundation elements of Tier 1 positive behaviour support are linked in with the FREEDA principles, or they're linked in with the United Nations Conventions for people with disabilities. But we're using behavioural science to train and deliver these core principles for vulnerable adults.
Yeah, and evidently what we mean by behavioral science is just what we can evidence. I mean, it's if anything, what we stand for is a commitment to the evidence base.
Yes.
I guess you'd agree with that, you know, and we will go where the evidence leads us. And that's
when I was
really
talking about behavioural science there, I meant, you know, in terms of teaching people. So,
yes, of course. Yeah.
So behavior, as in like using behavioural skills teaching to develop the skills in frontline staff. Because what we always think of it, I think, so that's one of the findings of this research program, is using behavioural skills teaching in the workforce development program, because we always think of behavioral science and applied behavior analysis just with the person supported, but actually we really can use it on such a broader level in terms of increasing the capacity and enriching and improving the quality of the services that we provide for people supported.
Yeah, and that loops back around as well to this notion of practice leadership.
Yes.
You know, you have to see it done. It has to be demonstrated in the environment, and all the other features of behavioral skills training that all the other features that we associate with behavioral skills teaching. That's brilliant. I'm thinking kind of the wider implications then in terms of we touched on human rights there and the FREEDA principles, but there's also you know, that Tier 1, it is kind of, it's quite visionary, if you like, because like what we really do need is communities that are enabled to support people locally, and that, you know, that the support comes to the person as close to they are to maintain their family relationships and maintain home life, and that kind of thing. So, you know, like hopefully we'll see that develop as well, where the way children that will need this support in the future are identified, and how that plan around a child and family is developed over a period of time. That's something that was touched on in our last event with Professor McGill and Professor McLaughlin and Dr. Jacobson, that, you know, as well as they also touched on how this can be data driven, because we can know what people need, but there's an administrative cost to that data drivenness of it, like, you know. Sorry if I went too broad there, but
no, but like it's also that lifespan perspective, isn't it, Alan? You know, it's like children then grow into adults, and then there's such a change then in the services that are like, it's dramatic, the difference. But something you said there as well about that link, that direct link between the person and their community, like with adult disability service provision, the direct link for the person supported, the most vulnerable person, is generally the frontline staff. And traditionally, in adult service provision, frontline staff have the least amount of training. And that's what this is not something off the top of my head, this is what the research shows us.
Yeah.
You know, so services have, and this is where implementation science is just perfect for this type of model. Services have all these manuals and policies and strategic plans and statements and aspirations, absolutely, to provide the most quality, the best quality of service. But fundamentally, it's the frontline staff that is the direct link to that individual. So with these Tier 1 supports, you know, you are really focusing in on that link, that relationship, that key, you know, link, I suppose. Yeah, I've said it already, between and it's directly for the person supported. So that part, so that it's the key worker, the direct link that is supported to provide the best quality supports for that individual. Because otherwise, we're missing it. We're missing a step. You know, we really are. So that's where the resources really need, I feel, to be directed, and this model is a way of doing that.
Excellent, excellent. Well, emphasizing the importance of the relationship between the person supported and the people actually doing the supporting, that feels like a perfect place to conclude. Deirdre. So thanks very, very much for your time. I hope people find this conversation useful, and look forward to seeing what you'll do in the future.
No pressure. Thanks, Alan.